Hi, I'm Dr. Enoch Choi of medhelp.org, and I wanted to share some helpful tips on how to manage cellulitis, a skin infection that sometimes requires antibiotics. Um, the main thing to remember with a skin infection is that you need to keep that area of your body that's infected elevated over the level of your heart. The reason why that is that it helps drain the infection away, allows your body to be able to attack the infection with its white blood cells, the cells used to attack infection, and it helps deliver the antibiotics better because that area isn't so swollen, and the blood supply can deliver the medication that you're taking. It's important to remember that if you get a high fever, if you have shortness of breath, if you have any worsening before you're getting rechecked, it's something that you need to talk to your doctor about and consider being seen for. It's pretty hard to work when you have a skin infection like this, since you need to keep the area of infection above your heart, so you probably won't be able to work. You know, it's something that is hard enough to do that oftentimes you'll need to probably stay on the couch or just be resting with that part of your body, if it's an arm or a leg or whichever part of your body, elevated above the level of your heart. And you want to do that all the time, and probably for at least for the next couple days. You probably can't do your regular work that way. You want to keep if there's a wound, if there's an opening in your skin, you want to keep that clean and dry, but you can take showers. You want to change bandages over this area every day, and if you have been told by your doctor to do so, you can use some polysporin to try and prevent any local infection of the opening, and also keep the dressing from sticking. That makes it a lot more comfortable to take the bandage off. Oftentimes your doctor will ask you to come back for a recheck. If so, you should probably go and do that. And sometimes that's something that's done on a daily basis, especially if you need another dose of IV antibiotics, which some people need if the infection is serious enough. Now, how are you supposed to manage just lying on the couch all day? Well, you can take bathroom breaks. Try, make sure you can take a short walk, like for 10 minutes, say, 3 times a day, and ask somebody to help you, or you may need a cane or a walker to do that. And when you're not on that walk, keep that area elevated. I haven't told you enough times now, you have to keep it elevated over the level of your heart. That'll let the swelling go down. If you get the area wet with a shower, make sure you pat it dry after washing it. Put a clean dressing, a bandage, or Band-Aid on it after you wash. Whether or not you're showering, you can change that every day. Try and put something warm on that area, on the red part, every day, say 4 times a day for about 10 minutes each time, and that can help deliver more of your blood flow to the area. And make sure that you don't put anything restrictive, any tight clothing above the area that is infected, because you don't want to block blood flow to the area. These are some helpful tips, and of course you need to ask your doctor about specific instructions, but they're helpful hints for dealing with a skin infection called cellulitis.